So you've already kind of touched on it in terms of kind of early childhood trauma. That's really a big focus of a lot of healing work these days. How does early childhood trauma affect our neurobiology and development as we kind of grow into adulthood?
It's a really important question. And I'm wondering if I could maybe like pull that back a bit and start with an introduction to our nervous system and how it gets imprinted as early as in utero. And of course, this is where intergenerational imprinting or trauma would come in. So the Coles Notes version to, how does our childhood impact us and imprint us with trauma, and in particular our nervous system, would be that, if we're born into environments in which our foundational needs aren't being met from a neurobiological point of view, we know now that we have a need to be securely attached. And we know that our biology actually seeks this out. And it generates an enormous amount of internal pain if we can't receive that secure attachment. And Dan Siegel really outlines this well in his work. And he talks about the foundational S's that are that basically inform our system that it is securely attached. And those S's are to be seen, to be soothed, to feel safe and secure. And then another person that I like to refer to is Jason Gaddis's work. He is a relationship coach actually as well. And he's replaced the need to be secure, to be supported. And all of that supports secure attachment. So if you think about it, if we're born into environments in which any of those four foundational S's aren't met, then it's going to generate an enormous amount of survival stress in our system. And so when our nervous system is activated in survival stress, then we're experiencing the emotion of fear or anger and or despair. We can get into that in a bit. And so as a child, if those foundational needs aren't being met, we're motivated to, instinctively do whatever we can do to try to meet those needs. And so the challenge of it is that if we never get a rest from that survival stress state that we might be in because we're not receiving those cues of safety and security, then it can start to dysregulate the nervous system. And then we start to see some of the, quote, maybe symptoms of mood disorders that we talk about later on, or the symptoms of trauma showing up, or even symptoms of disease, right? Or distress. So that's a high level answer to that question of how our early childhood environments shape and mold us. The other thing we know is that our nervous system is informed by our in utero environment. And what we mean by that is that the nervous system of the mother, right, is informing and encoding the nervous system of that growing fetus and baby. And so I've actually done a talk about this because what often happens is when we hear that, our nervous system was imprinted and informed by the environment in which our mother was in at that time, typically what happens is the mother experiences a large amount of guilt and or resistance to hearing that, right? Because it sounds like it's blaming the mother and their environment, for whatever's happening. And so I will say that there's more to the equation than just that mother's experience of what's happening within her environment or their environment at that time, right? And so we have to take into consideration that, first of all, there's the mother's history, right? So the mother would have been shown how to handle highly stressful experiences. Basically, that would have informed her nervous system. And then we also have to take into consideration that there's factors within that external environment at that time, right? So her relationship, let's say, the political climate of the time, right? Social factors, financial factors, all these external factors that are being encoded, being experienced by that mother's nervous system, which then what's happening is that through a process of chemistry, really, the mother is sending information to that growing fetus and informing the nervous system